So we hope that we'll manage to enroll very quickly, but we are almost opening a trial called the VISION trial, or the HOVON-141. You always get a number in the Netherlands. And it's an intergroup trial between the Nordic group and the HOVON. And the big question is, if you have a relapse, and we know that with venetoclax ibrutinib you can get patients MRD negative, do you really need to continue treatment like the label? Both venetoclax and ibrutinib have in the label endless treatment until relapse. And I think there are three big disadvantages, and specifically they are actual in the Netherlands and also in the Nordic countries. First of all, it's very expensive, and when you have socialized medicine as we have, it's very difficult to sustain if you do this. And second, although the side effects are very different in chemotherapy, you still have side effects. And the third thing is that if you think of normal cancer biology, that if you continue treatment, one way or the other, you will get resistant cells. And then the question is, do you still have something to give them? And I think if you can stop treatment early, then you have all those three things. So the money, the side effects, and maybe you can prevent resistance. So the idea of this trial is if you give this combination of ibrutinib and venetoclax, and after 12 months you measure MRD, and in the MRD negative patients, we want to randomize a 2-to-1 ratio, stopping or non-stopping. And then the question is first, how many patients can you stop? And the second question is, if you stop and patient gets a relapse of their disease, can you still get them into remission with the same combination, or do you lose effectivity? And if you look to CML, which is a very similar trial that have been done in CML, there it worked pretty well. And we know now, because of these kind of trials, that 50% of patients with CML you can safely stop, and you can keep them stopped for a very long time. And probably CLL will be different, it will be less good, but it's a very important question to ask, I think.